Social prescribing, I think, is a really important development for North East London.
The advantage of having social prescribers linked to the PCNs is they're an integral part of our team, and the response from patients has been incredible.
I think one of the advantages of having social prescribing in a GP practice is it can really allow the practice staff to see that not everything is medicalised and that there are a variety of social support services and organisations in the local area that we can connect people to.
What we're able to do now is to provide a much more holistic framework for the way in which we deal with patients.
With a social prescriber, we're here to listen to anything and everything. So a lot of patients do really like that.
In my time at the Bromley by Bow Centre, I think I really noticed the way people need support around other aspects of their lives, and people often need the support to navigate those aspects as well, which is the role of the social prescribing link worker.
Social prescribing works in Newham. So if it works in Newham, it's going to work in the rest of London.
In Waltham Forest, we also have been doing social prescribing for several years now. It's been a really important but missing part of the service delivery food chain.
Social prescribing is part of the fabric of the community and primary care. And part of that is how we reach these at-risk groups, these vulnerable groups, particularly during this time of COVID.
So COVID-19 has been a challenge for everyone in primary care.
With lockdown came lockdown of primary care as well, a significant reduction in terms of the accessing of primary care by patients, of course.
There are a lot of vulnerable residents with lots of comorbidities who would have been having to isolate in their own homes as a result of the lockdown.
The need for social prescribing, I think, has increased exponentially with COVID.
Social prescribing really moved into gear to become part of the critical response to coronavirus.
During COVID, everything has kind of moved online, which was very demanding and quite hard for a lot of patients because you felt a lot of that digital poverty. And that was a big barrier that we found with a lot of patients even accessing GP appointments. But one thing I could say is very positive, there's been a lot more telephone befriending services, and a lot of elderly patients have really utilised those services and been really happy.
So initially we started off with our high-risk COVID patients. Then we looked at our severely frail patients. And now the practices are referring whichever patients they feel need social prescribing.
It's all about adapting and coming up with new ideas. So like now, we'll no longer ever be social prescribers who just take referrals. Like we'll always, from now on, we're going to be proactive, even if we start going back into work. So there have been good positive shifts from it.
I think social prescribing was important before the pandemic, and I think it has been really, really important throughout the pandemic and probably post once we leave and we go back to some normality.
COVID has shown us how we all need human interaction. We need relationships, friendships. This is what is key to someone's health and well-being.
What the practice under coronavirus conditions revealed to us actually was general practice holds a wealth of knowledge and intelligence about all of its patients. Through that understanding, actually, we could start to profile groups of patients who would likely benefit from a social prescribing approach.
And the fact that you could still connect residents to lots of different services has been a really significant and valuable part of the service provision and very flexible part of the service provision.
And because it's very much patient-driven, you kind of see that kind of change and you're able to follow those patients along those journeys.
There is a real synergy between the practice team and the link worker in dealing with that patient.
By allowing social prescribing the model to come into the practice, you're offering the patient a more personalised approach to care.
They need to be in the practice, part of the primary care team, for the practice meetings, for the integrated care management meetings. I think before we had social prescribing, it's a case of you don't know what you're missing. But once they start working, you realise, how do you manage without them?